I want to talk about funding to Māori. And we've seen Māori statistics really deteriorate under this particular government. We've got mortality rates, and I heard about health, but specifically in Māori health. And the closure of the Māori Health Authority has been detrimental in regards to Māori mortality rates here have increased from 7 age between non-Māori and Māori, 7 years, to 8.5. We've also, lowering the cancer screening, all of those types of things. That particular funding going into Māori health has really affected the 20% of the population here in Aotearoa that I'm talking about. And so you've got a $110 million cut to Māori development, which only now receives 0.2% of the total budget. 0.2%. How are we supposed to improve Māori lives here in Aotearoa and a commitment to Te Tiriti o Waitangi if it's only getting 0.2% of the total budget? That's a Māori development. If we make up 20% of the population, no wonder the Māori stats are dire. No wonder they're dire. Not only that, Māori unemployment is double that of non-Māori here in Aotearoa. Is there on 10%? Māori unemployment rates. So I want to know what here in this, and we've spoken about, we've discussed the different changes and the different issues facing Māori within the Finance and Expenditure Committee, but I want to ask, what are the settings that this government is doing that were set in the last government that is going to improve the lives of Māori, whether it be health, whether it be across Vote Māori? Because the problem is you've wound back, you've even to two budgets demonstrating 757 million reduction in Māori funding. Because if anything, we've seen the need for support increase in our communities. The stats don't lie, unemployment has increased, the mortality rates have increased, and that is all due to the rewinding and the taking of budgets that were specific to improving Māori lives, to live with some integrity, to live with some dignity. But this government continues to wind back many of the legislative stuff that was worked hard for in the last government with the pressure from opposition, the Te Pāti Māori in opposition. We make up 20%, and again, we'd receive at least 40 billion if we were on 20%. We're not asking for everybody else's share, we just want our bit to be able to improve the lives of Māori so we don't see the increase of these statistics. Health statistics, mortality statistics, justice statistics. We need to be able to have solutions that are by Māori, for Māori, to Māori. So we need to do that, and I just want to ask the government, have you got specific targeted funding to improve these statistics? Because at this particular time, they're actually getting worse. They're actually getting worse. You've gone up 2% in unemployment since 2004. You've gone up a percentage point in terms of mortality rates. And that goes to show that winding back Māori health initiatives has been fatal for Te iwi Māori. So I want to know whether this government and you as the Minister for Finance are going to have these fiscal settings to ensure that Māori can live with dignity and with some hope. But unfortunately, the current situation is that you rewind all of those solutions that were put in place to ensure that we can live with some dignity. So I just want to ask that question, what are your settings? What are you going to do to improve the statistics, because they're getting worse?
Honourable Minister.
Well, Madam Chair, I would hope that the member and I can agree that we share an aspiration to see all Māori doing better in New Zealand. Whether that is Māori children in our education system, who I wish to see achieving far higher rates of numeracy and literacy achievement, which is being delivered through our structured literacy and numeracy program. Whether that's more support for children with additional learning needs in our schools, which is being supported through our record boost to learning support in this budget. Whether that is people in the health system, who I wish to see are getting more timely elective surgery, better treatment in the emergency room, which is being delivered by funding uplifts in the health system and clear targets for the achievement of those things. In this budget, there are many initiatives which will lead to better outcomes for Māori. The investment boost policy will be taken up by many Māori-led businesses who will make investments that will make their businesses more productive for the future. The KiwiSaver policy will ensure that more Māori have greater savings in retirement and that more KiwiSaver funds are available to be deployed into New Zealand investments. And so, Madam Chair, the answer to the members' questions is yes, this budget is absolutely about delivering better outcomes for Māori alongside all New Zealanders.